Well, good afternoon. It's been a difficult start this fall. It's been tough on all of us. And unfortunately, we're not out of this yet. We're in the middle of a global pandemic, the worst we've seen in generations. And protecting our communities requires difficult decisions to be made. I've said I'd never hesitate to take action if it means protecting your health and well-being to protect the safety of our province. But before doing so, I've always said I have to see evidence, and I've been firm on that. Last night, our top doctors and health experts did exactly that. They presented me with brand new data from this week. At my direction, earlier today, Dr. Williams and Dr. Brown presented the latest data and outlined the justification for new restrictions in hotspot regions. My friends, you know exactly what I know. You've received the same briefing that I received last night. In the last week, the pandemic has picked up speed at an alarming rate. My friends, the situation today is extremely serious. On September the 1st, we had just over 110 new cases. 5 weeks later, today we're at 939 new cases. As we post record testing numbers, the percentage of people testing positive is rising too quickly, with some communities showing as high as a 10% positivity. The virus is starting to spread to older people, as the number of contacts for every confirmed case has exploded, sometimes in the thousands. All trends are going in the wrong direction. Left unchecked, we risk worst case scenarios, first seen in Italy and New York City. An increase in cases is just one part of the story. We're struggling to see early signs of further spread in long-term care. This is something we must avoid at all costs. And as long as this virus is spreading at the rate in the community, our long-term care homes remain vulnerable. Hospitalizations and the number of people in intensive care have increased by 250%. If current trends continue, Ontario ICU intensive care units admissions are predicted to more than triple in less than 30 days. Our hospitals will be overwhelmed, and we can't let this happen. Friends, we have to do everything possible to avoid widespread lockdowns, and we cannot go back to stage one. We need to keep our schools open and protect our long-term care homes. That's our top priority. Nothing matters more. We need to play the long game by making difficult decisions now. We can flatten the second wave. We can get the economy back stronger and sooner. So I convened my cabinet this morning to review the new recommendations from our health experts. The health officials have made a number of recommendations, and we've accepted all of them. Effective Saturday, 12:01 a.m., we're implementing new public health measures for Toronto, Ottawa, and Peel region. Restaurants and bars will be closed for indoor dining. Takeout delivery and outdoor dining will continue. Indoor gyms and fitness centers will be closed. Outdoor services and fitness centers will be permitted. Cinemas, theaters, casinos, racing establishments, museums, galleries, and attractions will all be closed in these communities. No personal care services will be allowed where face coverings must be removed for the service. Food courts and indoor dining at malls must be closed, except for takeout. All retail stores can remain open. Schools will not, I repeat, not be closed. Places of worship will not be closed. These measures are in effect in Toronto, Peel, and Ottawa for 28 days, after which they'll be reviewed by the Chief Medical Officer of Health and the Public Health Measures Table. I can't stress this enough. on how difficult, how painful it was to make this decision. My heart just breaks for these folks, and I understand what this decision means to each and every one of you. And I can tell you, I didn't sleep last night. Believe me, this weighs heavy on me for making this decision. I know what this will do to businesses who are already struggling. I want to talk directly to business owners and workers who will be affected by this. I've been fighting for you since day one, and I'll continue to fight for you. I'll do everything in my power to support you, and we'll never forget the sacrifices you're making. I was working through the night with the Deputy Prime Minister. They understand how serious this situation is. And the package of supports that they announced earlier today will make a big difference. They're extending the rent subsidy, the wage subsidy, and business loans. And for our part, we're ready to do whatever it takes. We won't spare any expense to keep you going right now. We won't spare any expense to support you through this. That's why I've directed my finance minister to make $300 million available to support affected businesses. This funding will assist small businesses with their next fixed cost during the next 28 days. This will include waiving provincial and municipal property tax bills, as well as hydro and natural gas bills. This money will be made available as soon as possible, and we will release more details in the coming days. These temporary measures will help, but every one of us right now, we need to rally around these small businesses. Please support them as much as possible. Please order takeout. We can all play a part in supporting our restaurants through this difficult time. My friends, this is a serious situation. I'm asking everyone to make responsible decisions to keep you and your families safe this holiday. We must do everything we can to stop this surge and keep everyone safe and healthy. I assure you, we can get through this by supporting one another, by looking out for each other, and by following the public health rules that keep us and our loved ones safe. I want to thank you. Thank you from the bottom of my heart, and God bless the people of Ontario.
Thank you, Premier, and good afternoon. I want to start by reiterating that protecting the health and well-being of all Ontarians has always been our government's top priority. As the Premier outlined, we are seeing a concerning trend in the number of cases and the number of outbreaks. We're seeing the number of contacts for confirmed cases as high as 100 people. The curve is not just growing, it's growing exponentially. Numbers have increased significantly, and we need to take action now and do everything we can to avoid a very severe second wave. Our hospitalization and ICU rates are also increasing significantly, putting our health system capacity at risk. And we are extremely concerned at the risk of community outbreaks spreading to our long-term care homes and other vulnerable congregate settings. We need to stop this dangerous trend in its tracks. On the advice of the Chief Medical Officer of Health and public health experts, we are tightening public health measures in Ottawa, Peel, and Toronto to a modified Stage 2 for a period of at least 28 days. We are prohibiting indoor service in restaurants, bars, and other places people go to for food and drink, including nightclubs. Indoor gyms and fitness centers will be closed, as will conference and convention centers, with an exception for the courts. While these measures are being applied in Ottawa, Peel, and Toronto, we are also advising everyone to limit trips outside their homes except for essential purposes such as work, school, groceries, medical appointments, and socially distant outdoor physical activity. This was certainly not an easy decision. We know that we are asking for very real sacrifices from Ontarians. But this is about potentially preventing something much worse. We need to act now to keep our schools open, to protect our seniors and our loved ones in long-term care, and to avoid the need for stricter measures in the future. And I do want to remind everyone that the best way to protect one another is the same advice we've been following since this outbreak began in March. Maintain physical distancing. Wash your hands thoroughly and regularly. Wear a face covering when physical distancing is a challenge or it is required. And please stay home when you aren't feeling well, even with mild symptoms. And please download the COVID Alert app to your phones if you have not done so already. We know this is no small sacrifice, particularly as we are entering the Thanksgiving long weekend. Please only celebrate with those in your household and gather with friends and family virtually. We all need to heed the advice of our public health experts if we are to stop the spread of COVID-19 and prevent future lockdowns. Thank you.
Okay, we'll go to the phone line for questions. First question, please.
First question comes from Haley Cooper of News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. You mentioned that we run the risk of turning into an Italy scenario or New York scenario if people don't take each and every restriction seriously.
Yeah.
So we wanted to know how long until that becomes reality if people don't take these restrictions seriously. Would it be 5 days? Would it be 3 weeks? Would it be 2 months?
I'll pass that over to one of the doctors, Dr. Brown, Dr. Williams.
Thanks. As we mentioned earlier on in the technical briefing, the first threshold that starts to limit access to care happens within 30 days under any scenario, and under the worst case scenario happens much quicker than that. After that, it really depends on how quickly the pandemic accelerates, but it's a matter of weeks and days, not a matter of months.
Follow-up?
Thank you. And my follow-up, has there been any talk about locking down the most at risk, so seniors and those with serious health issues, and limiting their exposure to the public as a way of keeping them protected and perhaps not having to shut down large communities and sections of the province?
Great. I'll turn that over to Dr. Williams, actually.
So as in the first wave, we didn't lock down our seniors over the age of 70. We asked them to stay home. We asked people to support them in their home settings. We knew that sometimes they had to go out for medical reasons and sometimes to go and get medications to keep their external visits down in frequency and in scope and range. We're asked them again to bring those aspects back again. We asked them to be careful as we have, especially in the zones, the hot zones we've talked about, and some others that are getting more activity at this time. So they need to limit their outdoor activities, limit their contacts. If they're going to do combine with a household that you have been, ensure that you are aware of what their exposure has been limited and that you're very careful with your contacts. So we're not locking down, we haven't done before, but we have given strong recommendations to limit and limit your exposures and to be careful except for very essential and critical components. And we know you did well in the first wave. We need you to do it well again this time.
Next question.
Your next question comes from Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hi, Premier. With all due respect, it seems like you were the last one to see this coming. There have been countless pleas for you to crack down further from the Ontario Hospital Association, doctors, epidemiologists, the City of Toronto's Medical Officer of Health. Why has it taken so long to come to this realization?
Well, I take the advice, and I always will, off our health table, our scientists, our epidemiologists, and I got advised last night, and I went through the briefing at 7 o'clock last night. I made a decisive decision to act immediately, to move forward with the recommendations. I acted immediately with our finance minister to put together a package of $300 million. I called the Deputy Prime Minister, had a great conversation with the Deputy Prime Minister, and I want to thank the Deputy Prime Minister and the Prime Minister for acting immediately, which I thought would take a few days. They came out today with packages for these people affected, no matter if it's the wage subsidy, the rent subsidy, or us taking care of the hydro, the gas, any overhead costs that these folks are struggling with. Cynthia, believe me, I understand. Talk about staying up all night and thinking about this. These are friends. Like, we all have friends. You have friends. We all have friends. These are friends that we all know, people in our communities that run these small businesses. I stood up here for days fighting, saying, no, we got to keep them going. And after the numbers I saw yesterday, I remember just it was a few days ago, there was 500 cases. I thought, okay, can we make it through? And all of a sudden the spike jumped up to over 937 cases, almost doubled in a few days. If I didn't make this decision now, I'd be negligent. We're putting extraordinary measures and support for these companies, and I'll continue to support them. But I'm just asking the people, please, just go by the guidelines. Please order takeout, support these small businesses. We can support them. It was. I'll tell you, Cynthia, it was the single toughest decision I've made since I've taken office, bar none. And I take this serious when we're messing with people's lives, but we can all help out. We can all pitch in. We can have takeout delivery. We can help them. They're going to continue being able to sell wine, beer, and spirits as well. I've asked the finance minister to pull out all stops to support these people. And we will get through this. As sure as I'm standing here, we will get through this together. The whole world is going through this. And the jurisdictions that have had to try to skip over this has come back and bitten them in the backside there. But we will get through this. We will come out stronger than ever before.
Follow-up.
Premier, as you mentioned, just a few days ago, we were at 500 cases a day. I think it was on Tuesday you said that we're starting to see a flattening of the curve, and now, this massive increase. Did your own data let you down? Was it the backlog that contributed to this data coming so suddenly? Have we actually been in this situation for far longer, but the backlog and the testing failures have just made it come to light now?
You're right, Cynthia. I remember that distinctly. And these are all the things you sit there and think about. For a few days, we saw 500. We saw a little jump in 600, went back down to 500. And again, when they showed me what you saw today and everyone else saw, I had to act immediately. I was on this immediately. We said we have to move forward with this, because we see what's happening or could potentially happen when we see the acute care beds in hospitals jump up 250%, as the data showed today and as they showed me last night. ICU beds could be maxed out in a short period of time. We had to respond, and I'll pass this over to Dr. Brown. Thank you.
The data that we showed last week did show a trend upwards. The data that we're showing this week is showing an acceleration of that trend. This is the nature of an epidemic that is going to continue to accelerate until public health interventions are put in, and then you'll see the decline in contacts and you'll see the abatement of this surge of the epidemic. Without, at any point, the public health interventions will reduce the trend upwards. And at this point, we brought back new data that showed a substantial increase around testing data. It showed a continued spillover into older age groups, and the ability to kind of look at some more detailed data as well.
Next question.
Next question comes from Travis Danrush at Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. How you doing? Listen, I know that you were trying to avoid this, and I detected that you were getting a bit emotional there when you were talking directly to business owners. You said that you were up all night thinking about this. I'm wondering if you could tell us what you were thinking about, and ultimately, what was the red line for you when it came to that data that you looked at?
Well, appreciate the question, Travis. Just like yourself and everyone in this room, everyone I'm talking to at home has their favorite restaurant. In our case, I get around quite often around the province and talking, and everyone seems to have my number and they're calling all night saying, please help us. So that hits you in the heart, believe me. Trying to help these people that work day in and day out, work 18 hours, and they're holding on. And then I get this news, and I'm the guy that has to make the decision. Talk about weighing on you. Yeah, oh man, you have no idea. And it's tough, but I want to tell them, we're there to support them. We will get through it. I promise you, we will get through this together. I will be there beside you every step of the way. Our government will be there. The federal government will be there. And most importantly, I truly believe, as we've done from the beginning, the people of Ontario will be there to support you. I've had calls this morning from other premiers asking for help, asking for support. You know, they'll give us the support. Everyone stepped up. But yeah, it's tough. I started off in a family business, so I get it. And these restaurants are small, mom and pop shops in a lot of cases, and they need our support. And I'm here to tell you, I'll do whatever it takes to make sure I'm there 24/7. And that's why we put out $300 million immediately. And that's why, speaking to Christia last night, I said, whatever it takes, we need to support them, and she agreed 100%. I know my finance minister made the call as well. So it's tough. I'm going to pass it over to the finance minister on some of the areas that we're going to support these small businesses for.
Thank you, Premier, and thank you, Travis. So the Premier a number of weeks ago asked that we work on a plan. Obviously, there was the potential for this to happen. We've been in discussions with the federal government as recently as last night, and as the Premier mentioned, speaking with the Deputy Prime Minister, I know that the Deputy Prime Minister was quite moved by the Premier's saying, you know, we need to get this done now. And again, I commend her and the Prime Minister for not just talking but acting. In terms of our specific supports, we have been working in terms of property tax. I spoke to Mayor Watson, Mayor Tory, Mayor Brown today about the mechanism to make sure that both the provincial and municipal portion of the property tax can be rebated, and they are on side for working with us on that. My colleague, Minister Rickford, the Minister of Energy, has also been working on plans on how energy costs, whether they be natural gas or hydro, can be either rebated or covered. So that $300 million, I have to say, is also not just for any community. It happens to be today for the communities that are affected by these advanced public health measures. But we have to understand that we are in the middle of a pandemic. We could see the expansion of these public health measures at some point. We are hopeful that it won't happen, but it could be now, and it could be sometime between now and when the vaccine happens. So this provincial government will be there. We'll work with whether it's our municipal partners or our federal partners to make sure that the businesses get the support that the Premier asked for.
Follow up.
Okay, thanks, guys. Now, my next question for Premier Ford. So, Premier, considering where we are right now, what do you think went wrong here? The vast majority of the country is moving forward. They have not had to re-implement lockdown measures. Ontario has. Now, Dr. Williams has put the blame on the public. You have said, however, that the vast majority of people in this province are doing a good job. Is this completely the public's fault, or does your government take any responsibility? And do you think that you have been getting the best advice possible from the health table? Because at times it has contradicted what local health officials have said and advised.
Well, I appreciate the question. I always look at the province that's probably the closest size, closest jurisdiction to us, and it's Quebec. Their numbers are even higher than ours. They've had to do a lockdown in Quebec City and Montreal. But again, Travis, this isn't an easy decision. I have to go on the best advice that is given to me. I have full confidence in Dr. Williams, Dr. Brown, Dr. Yaffe, Dr. Heyer. There's a whole team, and I've always said this. It's not per se Dr. Williams by himself. I know he consults with many, many other professionals, be it epidemiologists and scientists and everyone in the health community. And once they give me that information, then I have to make a decision. I have to do it immediately. And I'll pass this over to Dr. Williams to follow up. Thank you.
Yes, and I think the question is, when you say the blame, I think the responsibility is us as collectively as Ontarians We've shown, and we talked about that in our technical briefing, that, and Dr. Brown's alluded to the fact that you can't contact your way out of it, contact trace your way out of it, or test your way out of it. If everybody does as we're supposed to do, and we did that during the first wave, people kept the distancing, they avoided contacts, only went out with essential things, we showed we can do it, and I think we can do it again. I think people got casual the end of August into September. Our social circles dissipated, and people had many contacts in many different ways. We saw that with the evidence right now with our contact tracing starting to get overwhelmed, where we had only in the first wave sometimes 3 or 4 people, up to 10 maybe, 12 people to follow with a case. Now they say it's quite common to have 20, 30, or 40, even up to 100 with one case in the previous 5 to 7 days. That's just not acceptable. Is it blaming public writ large? I think, as the Premier said, a lot of our Ontario citizens have stayed the course. Most of our areas in Ontario have less than 5 cases per 100,000, and they're doing that. So they're continuing to do well in that. We've had some difficulty in some of our urban dense areas, our 3 primary ones right at the moment, and some of the surrounding ones. And I think there's a lot of people in those areas are doing what they need to do, but they do need to make sure it's a coordinated, a consistent approach by everyone. And as the Premier said, we can bring this down. And that's why we're bringing these steps in now, that we can reverse this, even hopefully within the 28 days, and that these closures can be considered to be reopened again. We can collectively do this, I believe that. And I think that everybody has to do their part. It's not just someone else's job, it's our job collectively. We did it, we can do it again.
Next question.
Next question comes from Sean Jeffords of the Canadian Press. Please go ahead.
Hi, Sean.
Sean? Oh, we'll go to Colin.
Please go ahead, Colin.
Hi, Colin.
Oh, hi, good afternoon, Premier. During the first wave, many of the measures were only possible under a state of emergency. You ended that state of emergency over the summer and transferred the powers to your own government. I'm wondering, do you actually have the authority under the current legislation, Bill 195, to do some of the measures that you're doing right now? And are we back in a state of emergency?
We do have the powers. We checked with legal, and they said we do have the powers, but we have to move forward as quickly as possible on this, Colin. And I wish we had more time to sit back and debate and go back and forth, and but we don't. If we don't act now, it's going to get worse. And if we don't act now, we're going to be in much worse shape in a week down the road or 2 weeks down the road by closing things down. And if you don't mind, I can pass this to the Minister of Health, and I'd appreciate that. Thank you.
Well, we do need to take the steps that we're taking now. We do have the legal authority to do that. But as has been emphasized by Drs. Brown and Dr. Williams, that if we don't take this action now, the situation could overtake us, and then we would have to impose a complete lockdown over a much longer period of time. So do we want to do what we're having to do now? No, of course we don't. But it's counterintuitive, I know, to say it, but it's going to be better for our economy if we take these steps now rather than wait until the situation spirals out of control. Then we'll have to take some very stringent measures over a further period of time.
Follow-up?
Thank you. And Premier, sorry, just to re-ask the second question there, do you believe that Ontario is currently back in a state of emergency?
I wouldn't say they're in a state of emergency at all. There's 3 areas, be it Ottawa, Peel, and Toronto, that are facing some real challenges right now. But this is not a full walk back to stage 2. It's a partial walk back per se. We still have the retail malls open, still have businesses open. It's just certain areas that we need to close, but in saying that, we need to support them as well.
Next question.
The next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. With all due respect, because I know how much pressure you and Dr. Williams and everyone is in, and things are coming at you fast, but is this action today a sign that your plan of targeted measures has failed. People have been calling on you for at least a couple of weeks to restrict certain things, and you were adamant that it didn't need to be done. And then all of a sudden, you're caught off guard by these trends that other people seem to see coming.
Well, I wouldn't say that, Rob. You know, I'm always believe that the glass is half full. I also have the pressure of the economy on me too, and I've had so many people, you know, calling, and you know, it's very hard to talk to people when they're struggling and they're just barely getting by, and I have to do the balance between health and safety, which is the #1 priority, versus the economy and keeping people moving. And I think Dr. Williams, and I've said it all along, and I'll continue to say it, and his team they've been very pragmatic. Could have they come to us and said everything gets shut down in Peel, Ottawa, and in Toronto? I'm sure they could have, but they took very thoughtful, methodical steps to do that balance. And after a lot of study, talking to the scientists, epidemiologists, and other doctors, they've decided to take this route, and I support it. And we're going to work with all the business owners to support them and get them through this.
Follow up.
Okay, thanks for that answer, Premier.
Thank you.
In hindsight now, and you do seem a little bit rattled or shaken today, do you think you waited too long on this? And do you think you need to bring some fresh voices into your circle of advisors?
Well, with the, did you say French voices? What did he say?
Fresh, Premier.
Fresh, okay.
Yeah.
I thought you said French. Well, we're always going out there and getting advice. I know our medical team is constantly reaching out to people right around the country and right around the world, always getting advice and looking at models throughout the world, be it Netherlands versus Germany versus Australia. And we saw what happened in Australia. They jumped ahead. They basically had to do a complete shutdown and go backwards again. And we don't, you know, we don't want to go that way. Yeah, is it tough? Rob, 100% it's tough on me right now because I'm dealing with a lot of lives right now. But I have confidence in the people of Ontario. And a few days back when it was 500 and we saw that for a few days, I felt, you know, can we make it through it? And obviously the numbers spiked up to close to 1,000. And I always will, and I always have to listen to the medical advice. I'm not a doctor. You know, if you want to talk to the economy and numbers, the guy behind me, Rod, is an expert, and I'm pretty good at when it comes to numbers and businesses. That's my forte, but I have to rely on the health and science, and I always will. I may agree, I may disagree, but when the experts come to me and say, this is a scenario, and if we don't do this, this will happen, I'm listening to them. And there's so many experts out there, so many people and doctors that might have a different opinion or whatever, but I have to rely on my team that has brought me through this right from day one. I've relied on Dr. Williams and his whole team, and I'm going to continue relying on Dr. Williams. I don't believe in changing the dance partner in the middle of the dance here. He's been phenomenal, and I'll tell you, I'll stand shoulder to shoulder with Dr. Williams all day long, any day, because he got us through the people that sometimes have a short memory. He got us through the worst of it before and got us back down to 100 cases. And then I agree with Dr. Williams, all of us, maybe even the government. Maybe we got a little too lackadaisical, everyone, when we saw 80 cases with a population of 14.5 million people and everyone thinks it's fine. It came back to bite us as we all went out there. And now we have to tighten it up until we don't have to go to the extreme again. That would be again, it would be an economic disaster if we had to go back to stage one.
Last question.
The last question comes from Ryan Schmelty from National Post. Please go ahead.
Hi, Ryan.
Yeah, hi, Premier. I'm wondering, the federal government announced their business supports today. If they had been able to announce them earlier, might you have imposed these restrictions earlier?
Well, I got the advice last night, again, at 7 o'clock. I acted immediately, and we acted immediately talking to the federal government along with talking to the finance minister, asking him to put a package of $300 million together. But I don't believe the numbers were there. A couple of weeks ago, we didn't see these numbers. We saw them creep up, and then all of a sudden, over a day or two, bang, they literally they doubled. So that's when the decision has to be made. But it's not too late, folks.